Hello, everyone. Thank you so much for attending our Public Policy Symposium kickoff tonight. We're really appreciative of you joining us. My name is Matt Plord. I'm a sophomore at NYU.
My name is Taylor Vidston, and I'm a junior here. We're very excited to have Professor Pomeranz from the NYU School of Global Public Health here to give a presentation and answer some questions afterwards. But before we begin that, we wanted just to give you all a brief introduction to the 2020 Public Policy Symposium.
Yeah, so the symposium is an annual event sponsored by the Politics Society. And this year we're really excited, like Taylor said, to be hosting it alongside the NYU School of Global Public Health. Each year, students participating in the Public Policy Symposium from across the country and from a diverse range of ideological, geographic, and experiential backgrounds descend upon New York University's main campus in Lower Manhattan, virtually, of course, this year, for a formal weekend-long debate over some of the most salient issues of our time after developing these really lengthy policy proposals on each one of the issues. The aim of the symposium is really simple. We want to end the weekend every year with a powerful slate of consensus-based policies that demonstrate that such policies, which come from rigorous and open exchange, are still both attainable and effective.
Participating in the Public Policy Symposium allows students to gain a better understanding of the topic at hand, strengthen valuable skills like public speaking, leadership, debating, and policymaking, and networking with people and organizations from a wide variety of fields and professions. This year's symposium will center around the broad and ever-expanding issue of public health, with subtopics including, but not limited to, pandemic preparedness and response, environmental impacts on community health, gun violence, and housing. In addition, we encourage participants to pay particularly close attention to the way that each one of these issues is impacted by social determinants such as race, socioeconomic status, and geographic location.
So you can reach out to us, Taylor and I, as you've probably assumed by now, are the co-directors of this year's Public Policy Symposium. You can reach out to us and learn how to get involved by emailing us at publicpolicysymposiumnyu@gmail.com or by heading to our link tree, which is linktr.ee/NYUPPS with any questions or to request to stay on our mailing list. So now let's introduce our guest for today, Professor Pomeranz. Taylor?
Professor Jennifer Pomeranz leads the Public Health Policy Research Lab here at NYU and regularly teaches public health law and food policy for public health. She is a public health lawyer who conducts research on policy and legal avenues to identify products that cause public harm, address issues within the food environment, and to fight injustice that leads to health disparities. She has also authored numerous peer-reviewed and law-reviewed journal articles and a book published by Oxford University Press in 2016. Today, we are very lucky to have her here to discuss preemption in local public health and its impact on our communities. So without further ado, we'll hand it over to you, Professor.
Thank you both so much, and I'm really thrilled about your this whole event that you're hosting, and it's great that you're doing this, especially now and with these topics. Public health is the most important in my mind, but and I'm glad that other people are starting to agree. So I'm going to share my slides, and we will get started right away. I will be talking about a legal concept of preemption that actually affects all public health issues. And so it's really a conversation on state interference in local public health. I will first just briefly identify the US government structure that leads to the issue of preemption and define preemption, and then we'll examine its effect in public health. So the US system, The US system is based on a federalist system where the federal government and the state governments are created by the US Constitution as separate sovereigns, so they each govern themselves. But the US Constitution does not actually mention local governments. They are completely a creation of the state. So a local government is New York City, Chicago, and also little towns, and sometimes they're called political subdivisions, cities, counties, municipalities. Because they are a creation of the state, there's great diversity in state and local relationships within a state, meaning that some states actually grant big cities more power than small towns. And then across states, there's a huge difference in how much authority local governments are granted by the states. So in all local governments have some type of autonomy and authority, and the state legislator retains some type of control, meaning no local government can act to the same extent of a state. States always have more authority than local governments. But because there are various issues, there's really a big question on whether local governments can act. Sometimes local governments can only hire personnel, and other times local governments can engage in full public health authorities and taxation and other types of behaviors that allow them to engage in a broad range of policy making. But so what's the topic of preemption? Preemption is when a higher level of government withdraws or limits the authority of a lower level of government to act. So I'm going to really delve into this, but when I mentioned the federal government is the highest level, then the states, and then local governments. So what we're talking about here is a higher level taking away or limiting the authority of a lower level of government to act. So the legal term for preemption is actually called ceiling preemption. The idea is it's a legal tool that the government uses in order to set maximum standards. So the federal government can pass a law preempting state or local control. That means that state and local law cannot exceed or conflict with federal law. And the same for the states. The states can pass a law preempting local control, meaning that local law cannot conflict with or exceed state law. There's another term that's an unfortunate term, but I feel that it's important to understand and differentiate. The term floor preemption, it actually means minimum standards. It's not preemption in the same sense. So it's really just minimum standards. Minimum standards are quite different. This is when a state would set minimum standards and localities can go above those standards. And I'll give you an example so it makes it clearer. And this allows for additional protection and local innovation. So a major success using this concept of floor preemption or minimum standards is the Federal Civil Rights Act. The Federal Civil Rights Act provides specific protection to specific groups, for example, based on race, ethnicity, or national origin, and protects against discrimination. This is a floor protection, which actually allows state and local governments to provide additional protections. So for example, states and local governments can provide LGBTQ plus additional protections because they're not protected under the federal law. So this is an effort that can support public health and social justice and allow for additional protections. So this is why it's not preemption. And for now on, when I'm speaking about preemption, I'm speaking about ceiling preemption or the maximum standards. So where is preemption necessary? Clearly, we need federal aviation laws. For example, if you had a law where every time an airplane passed over a state, they had a different law attached to it, for example, no smoking or yes smoking, that obviously makes no sense. We need federal laws for aviation. Where have we come to accept preemption as common or maybe necessary is labeling requirements. We have many federal labeling requirements. These are two examples. And it makes sense for businesses who are doing business across 50 states that they don't have to have a different label for each state's laws. It would make it very onerous to do business across the 50 states. But what's really going on in public health and what's the real concern is actually not federal preemption, but state preemption. States have an even broader authority to preempt local control because the local government is just a creation of the state. If a state really wanted to, it could actually abolish a local government. This wouldn't happen in modern society given how much authority and need there is for local government, but in reality, they could get rid of local governments. And a state legislator may value uniformity across the state or statewide standards or having control over an issue. If they have these values and also value public health, they can pass minimum standards, the ones I was just discussing, and allow localities to provide additional protections. But what we're seeing is them engaging in preemption usually that hurts public health. But because I mentioned that preemption is a tool, it can be used pro public health. So I put good preemption here because this is a subjective term. I believe public health and public health policy is good for society. So I'm using this, you know, subjectively to say there's also preemption that's used as a tool to not hurt public health or social justice or civil rights. Here's an example. Oregon has a sanctuary state law that prohibits law enforcement from requiring people who are violating federal immigration laws to leave the country. So there are other examples like this in civil rights. But for the vast majority of topics, we're not seeing that that's how preemption is being used. A survey of mayors and health officials across the country in major US cities found that the vast majority of them, almost 100%, found that preemption was an obstacle to local policymaking for 22 public health issues. And when this happened, again, the majority of them abandoned or delayed policymaking. So they weren't able to or realized that they just could not go forward with the policy because they were preempted from doing so. So what topics are we talking about? Unfortunately, many topics. So there is preemption for tobacco control, alcohol, food and drink, minimum wage, firearm safety, LGBTQ rights, plastic bag bans, fire sprinkler safety, CAFOs or concentrated animal feeding operations, or these factory farms, fracking, paid sick leave, and now COVID. And there are other topics, of course, but these are the big ones that we all study and track. So another reason preemption is of concern is because not only can local governments not act, but local governments are historically the innovators of novel and important public health policy that sometimes can actually spread nationally. So New York City is actually an innovator of some policies that became federal law. So menu labeling, if you've gone to a fast food restaurant, you've seen the calories on the menu. That started in New York City, and then it spread and became federal law. And so the local governments have always been laboratories for these ideas, because it's better to test something out in a smaller location than test it out in, of course, across the nation. So that's one real loss when we have preemption. And then the other is just, frankly, local democracy. People vote for their local representatives because they know the needs and values of the community and can respond to them. The other real problem here is an equity issue when there's health disparities and different types of problems in a community, where if the state preempts the ability of local governments to act, the states don't tend to act to protect these values and needs in a local community. So there's a loss of local democracy in states that preempt, and some states preempt a lot, and there's really a huge loss of local democracy. And then those people are not able to be protected from public health or social justice or civil rights laws that are being preempted. So those people actually don't get the value of public health policymaking in those communities. So at its base, what we're really seeing is that preemption is often a divide between the corporate interests that make money from these different ventures and products, and then the populations in the communities that want to protect themselves from the health and safety dangers that are present. So let me give you some examples of what we're seeing. So in COVID, there are a few states that are engaging in that minimum standards method of regulating. Maryland is an example. It issued statewide stay-at-home orders, and it was a regulatory floor allowing local governments to be more protective of their populations based on their local conditions. And there were certain counties and then the city of Baltimore that decided to go on a slower timeline than set by the state. But what we are seeing also for COVID is that many states issued orders that preempted cities and counties from imposing stricter requirements. This has led to some litigation, and there's also now additional concerns over the difference of opinion over opening and closing of schools that are happening. But these are some of the states that are preempting local control over COVID safety requirements. And then here's a map. These maps are from 2018 of the states that, the red states here, preempted local governments from requiring automatic fire sprinklers to be required in new construction. Fire sprinklers are very inexpensive, and they save lives and buildings if there's a fire. But the building associations lobbied the state legislators to preempt the local governments from being able to require them, because it does increase, of course, the cost of building. Here's a map of paid sick day preemption. So in these states, local governments cannot require paid sick leave laws. And here's a similar map for food and nutrition preemption. These are like sugary beverage taxes or different types of nutrition labeling or disclosure requirements for food, or like silly things like Happy Meal bans, which was tried in one local government and nobody, I'm using the industry's language. A Happy Meal ban is not what it is. They were trying to keep the toy out of the fast food unless it met certain nutrition requirements. And that was a failed policy, but it was tried at a local level. They found it was not the greatest, and it didn't spread nationally. So that's actually the value of the lesson, rather than preempting it in places that would never have passed that law in the first place. And then the scariest in my mind is for firearm safety. 45 states preempt local control over the vast majority of firearm safety laws. California and Illinois preempt a few, and sometimes they have minimum standards, and then the other states in the Northeast and Hawaii do not preempt. But for the most part, you see almost the entire map is covered. It's almost impossible for local governments to pass the majority of firearm safety laws in the United States. And then the only somewhat success story is for tobacco for one topic. So there are a lot of tobacco control policies, but for smoke-free air laws, there was state preemption in 18 states in the year 2000. And then in 2002, Delaware repealed preemption. It was the first state to do this. And this is a very unique thing to do. Preemption is rarely repealed. And today now only 12 states preempt smoke-free air laws. So a few other states repealed. And tobacco has been unique in a few ways, but does have lessons for us all. The grassroots movements are very strong in tobacco because secondhand smoke affects everybody. And they've been working very hard on these topics for decades. The advocates and stakeholders also make anti-preemption part and parcel to their pro-public health policy advocacy. So at the same time that they're advocating for tobacco control, they're advocating against preemption. And of course, the tobacco industry is perceived differently than almost all the other industries. Millions of people like Coca-Cola on Facebook, and so we're talking about a different world of who basically public health is up against. And then the industry engages in its own tactics to pass preemption. They have closed door meetings or non-transparent meetings. This is a picture that was taken and publicized by the Sacramento Bee of the former governor of California, having dinner with executives from the Beverage Association and Coke and Pepsi. And then right after this, the state preempted local sugary beverage taxes. And this picture came out after that. They use misleading frameworks. The framework in Washington was yes to affordable groceries, but the actual ballot initiative was to preempt just soda taxes. But of course, if you actually read the ballot initiative, I would have voted to agree with yes to affordable groceries too. It's written in a way that says, yes, we should all have affordable groceries. But the real legal result was to preempt sugary beverage taxes. And then in addition, there's big money behind these campaigns. In July, which was months before the actual campaign, they're spending millions of dollars to just gather signatures for the ballots, and then also more millions of dollars to campaign for the vote. Also, there's confusing language. The American Legislative Exchange Council is a pro-business group that actually drafts model legislation. This is an example of model legislation that was passed in Kansas and 2 other states, preempting different food policies, nutrition information. The consumer incentive items is the Happy Meal ban I was mentioning. And then what are food-based health disparities? It's not defined in the law, but so because it was not defined in the law, the public health advocates had to worry about what it meant. And then now the local governments have to worry about what it means, because they don't want to, they can't engage in preempted activities. But when you don't know what it means, it prevents you from engaging in a much broader array of policies than they might have done so. And so this creates a lot of confusion. And then also there's this idea of front groups, and also astroturfing, which is a great term that I wish I invented, that is a fake grassroots movement. These are actually pictures from anti-soda different soda policy campaigns, but similar things are going on a little bit more behind the scenes in preemption, where they're actually not just regular people. These are examples of paid people that are opposing a policy. We're seeing the same thing in preemption, where the like subsidiaries of the entities that are proposing preemption are the ones that come out in support of them, pretending to be these like front groups or grassroots movements. And so there's a lot of kind of unclear messaging going on around preemption. And then lastly, who actually is passing preemption, but the state legislators. And so I conducted a study with my colleague, Diana Silver, and we looked at 5 policy topics: tobacco control, firearms, paid sick leave, food and nutrition, and civil rights. And we found that the state legislators engaged in these 5 methods to pass and support preemption. I'm gonna go through each of them, but they passed preemption quickly. They obscured preemption, repealed and replaced it. They preempt litigation, which I'll explain, and they enacted punitive preemption. Again, I'll explain. So the first tactic was to pass preemption quickly. For the 5 policy topics, the average time from proposal to passage was 2 to 6 months. So the bill, how a bill becomes a law, it took 2 to 6 months. But for these preemptive laws, it took days. It's astounding, the same day passage from proposal to passage in 2 houses. So the way the state legislators are set up is the same as the federal government, except for Nebraska. And none of these are Nebraska laws, but so they passed 2 houses in the same day as that was proposed. So this is clearly something that was known in advance to some legislators. And then 1 to 2 days, 3 to 4 days, 9 to 10 days, and 18 days, like astoundingly quick. Another method was to kind of bring preemption into other topic areas to obscure it by either adding it to pre-existing bills on non-relevant substantive topics. So a bill that was going to be on some there was a kidney dialysis bill in Hawaii that all of a sudden tobacco control preemption was added onto. Bundling preemption of multiple non-related topics. So paid sick leave, LGBTQ rights, civil rights in one, which means that multiple stakeholders now are fighting, supporting or opposing, but it brings in many more interested groups when you're bundling it like this. And then titling a bill in a way that does not reflect the substance of the bill. This was an Arkansas bill that preempted local governments from passing LGBTQ civil rights, and it was titled as a statewide commerce bill. And the reason there are asterisks there are that 7 of these states actually have what are called single subject rules that require that a bill can only be on one subject. They actually violated their single subject rules, but the only way to enforce this would be to sue. And public health doesn't have the resources, and actually courts really struggle with interpretation of these single subject rules. So they just violate them and there's no recourse unless you sue, which doesn't really happen all that often. A third tactic was in North Carolina. They passed a law preempting civil rights for transgender rights, actually, and also paid sick leave. There was a very big public outcry, so they repealed it, but they actually just passed it again without having some of the, it was called the bathroom bill, if you remember, but without having some of the bathroom requirements. But the preemption actually was just reenacted. It's set to expire at the end of this year, but I don't know what will happen with that. We'll have to follow up. And then preempt litigation. What this means is that the state is actually providing immunity to an industry from a lawsuit. So this, there was one law like this in the study period from Utah on the topic of firearms, but previously, and so there's 34 states that preempt lawsuits against the firearm industry. The federal government also does this, so you cannot sue the firearm industry if you're harmed by a firearm. And 26 states preempt lawsuits against the food industry. So you cannot argue, for example, that a fast food restaurants, they constantly consuming a fast food restaurant's meals cause you diabetes or another diet-related disease. And then our last finding was this concept of punitive preemption. This is actually quite astounding. It allows people and membership organizations like the National Rifle Association, because this is only in the context of firearms, to sue local governments or local officials if they're acting in a way the state deems preempted. So if they pass a law, but even if they like hang a notice that conflicts with state law, local officials can also be fined or removed from office. And 15 states have this in the context of firearm laws. So I got a question before we all got started about what can we do. This is a really big problem in public health. There's not so many great like legal solutions. So the solutions tend to focus on advocacy and you know, voting and other things like that. But there is one legal answer. It's called a savings clause that you can advocate for at the state level, or state legislators can pass laws with savings clause in them that actually that expressly allows local governments to pass laws. It's often paired with floor preemption or minimum standards. Illinois has a lot of laws like this in the gun context where they allow local governments to provide more public health protections, even though the state itself didn't. Another example is the National School Lunch Program that allows state and local agencies to impose additional restrictions on the foods to make them healthier in the school program. The other strategies are really for advocates. If you start at the top left and go counterclockwise with me, you would want advocates to expect preemption coming in some form, like the tobacco control groups expect it, so they're never surprised. And they're monitoring bills at all times to try to see if preemption is in it. Engage in grassroots movements early, not only on the topic of preemption, but the topics that you care about. Be nonpartisan. This is happening across states. It's not only in specific states, it's across states. It's not a partisan issue. It's about removal of local control. Or you know, not engaging in minimum standards when you are enacting public health policy. And then finally, uniting traditional and non-traditional allies. A lot of times there are different groups that actually feel the same on topics, even though they wouldn't expect to, or their topics have been bundled into one preemption. So you would want to work with them in that type of a scenario. And then again, to reiterate what the tobacco control groups are really doing is they're making anti-public health preemption part and parcel to their pro-public health policy activity. And I think that this is of utmost importance going forward for all the public health topics that you would care about. And then just normal communication with state and local elected officials that you would do anyway if you had an issue that was important to you, because even communicating with your local officials and their state officials can put pressure on the state legislator. So thank you so much. I'm happy to take any type of questions or comments.
Hello again. Thank you so much, Professor Pomeranz. That was a fantastic presentation that was incredibly interesting. And I certainly learned a lot about that issue. I know for a fact that our participants are surely going to pull a lot from that presentation when thinking about their policy memos that they'll be writing as well. So thank you so much.
Thank you.
We'd like first to invite, like Professor Pomeranz said, invite people to submit questions using the Q&A feature on Zoom. And while we wait for those to start trickling in, we do have a few questions here that have either been submitted prior or that we've come up with. So we'll just begin with those. Taylor?
Sure. So our first question was submitted prior to the beginning of this as well, but the question is, how do we disambiguate personal life choices and their effects on health from standards that should be globally mandated and secured for everyone?
Well, I think we don't discriminate against people based on their life choices for sure, and that's how we would start. But public health isn't. I would really kind of reframe that in a little bit. Public health is about making the healthy choice the easy choice, and not the harder choice, which often where public health is up against the fact that it's hard to be healthy even if you want to. If you choose to be unhealthy, that's your choice. But if you want to be healthy or have access to healthier life or minimum wage or paid sick leave or healthy food or an environment where you don't have to breathe somebody's tobacco smoke, or I mean, the list goes on, or you can be free to have housing and I mean, there's a myriad of issues. Public health believes that we should have policy that enables that type of life. In the United States, in particular, corporations tend to have more power than the population. So often it's harder to be healthy. We don't have minimum wage. We don't have paid sick leave. We don't have basic health insurance. Healthcare. We don't have healthy food that's accessible and affordable, and the list goes on. So I think that's the public health frame of that answer.
Thank you. Yeah. So we did have a couple questions just roll in. Let me know if you can see this. There's an Answer Live button. Let me know if it shows up on your screen. This is our first time doing this, so we'll see.
Oh, okay. I can see it now. Are you aware of any anti-preemption advocacy efforts that have successfully used home rule argument statutes? So home rule and Dillon's law are two different ways a state establishes the local authority and control, and some states grant their local governments more authority, and some states grant their local governments less authority. There is one case was successful. Cleveland banned trans fat, and the Ohio legislator did not like that. And so it preempted the ability of local governments in Ohio from banning trans fat. Cleveland sued Ohio and won because they had the authority granted to it in the Ohio Constitution to do this. So this is an example. They're very few and far between of these types of successful lawsuits. And I would also note that if a state legislator was really, really motivated, they could, of course, change the state constitution. So that's just something to keep in mind, that they always do have the upper hands. Another question. I was wondering if you could give me more information on the process it takes for a public health intervention to be implicated. I'm sorry, I don't know what that means. If you wouldn't mind maybe writing it in other words.
while we wait for that, we can jump to another question, and yeah, if you feel free to just submit it again, and we can clarify that a bit. Another question that came in prior was just zooming in here. How has preemption impacted individual states in relation to COVID-19, the individual state's ability to procure PPE and ventilators and other equipment and implement other safety measures during the COVID-19 pandemic? You talked about that a little bit, but when it comes
Yeah.
to PPE and ventilators, that's certainly been in the news a lot as of late.
You know, to be honest, I forgot I don't think that the federal government preempted. I think they just didn't help. You know, I was just as discombobulated or whatever that saying is when this all started, that I didn't read the law of like how the federal government did this. They definitely, so usually the federal government, the reason why people were actually up in arms about that is that usually the federal government is the orchestrator when there's a national issue. You expect that the federal government would engage in like something for a national issue, and they have the powers to do so. And so I believe it was more about like shock that the federal government didn't do it, as opposed to blocking the ability of state and local governments to get protective gear.
Taylor, do you want to take the next one? It seems Han here has clarified their question.
Yeah, sure. So the
I think you're asking. Yeah, I see the implement. I think that you're asking. Are you asking how to pass, Han? If you wouldn't mind, are you asking how to pass public health laws?
Yes.
Okay, so for all laws, so the federal government and the states and city councils, it goes, so there's basically three types of law. There's case law that the Supreme Court decides, that's one law. There's regulations that are, they're passed by like health departments, but I think you're talking about laws that are passed by legislators, which is what most people in America think of as laws. So just like this federal government, the state governments, except for Nebraska, have two, it's called a bicameral legislator. So I'm just going to use the federal as the example. There's a House of Representatives and Senate, and they have to both pass the identical bill. And then it becomes a law if the president signs it, or if they, yes. And the same thing in the states. So the two parts of the legislature have to agree on the bill. They pass it, each passes it, and then the governor signs it. City councils and also the state of Nebraska tend to have unicameral legislators, and they all just kind of work on it together. But for the vast majority, they pass both of the parts of the legislator separately, and then it's signed by the governor. It usually takes months, if not years, frankly, for things to pass, or they never pass. There's a lot of bills that are proposed that never pass. And you can go on congress.gov to see like federal bills, and then the timelines are also set out, which is pretty cool.
Great. Looks like we have a couple more submitted questions. So the first one is, do any states currently have rules in their constitutions protecting local governments from preemption?
Not that I know of. You mentioned that preemption is rarely repealed. Why is that the case? Because because of all the reasons why preemption was passed in the first place, the industries that are supporting preemption are still there. They want the local governments to not be able to engage in this type of policy making. Unfortunately, I think we need, an entire overhaul of our entire system, because money is given to elected officials for their campaign. So there's this concept of campaign finance reform. So if they keep getting money from the industries that want a preemption, they're clearly not going to move to repeal preemption. So something like kind of big has to happen for laws to be repealed, even in general, if you think about it. Like, for example, so the Affordable Care Act was passed under a completely different federal administration. Something big happened, a very different federal administration came in and has been chipping away at the Affordable Care Act. So usually big laws like that, or just laws in general, are not repealed frequently anyway. It's not super common, but preemption is especially is not been repealed because we're tracking it and we see that it's not being repealed. So we know that's the case, but it's because of the same reasons that it got passed in the first place.
Great. Yeah, we have two final questions here. So the first one, something I thought was a really interesting question. Are issues surrounding preemption particularly significant in the United States, given the federal system, when compared to other developed nations, or are there other countries that have similar issues around that?
Yeah, so it is, other countries have federalist systems, like Mexico is an example, and there are other countries with federal systems, but the United States, I would argue, is unique for a different reason. It's because than other developed nations. Other developed nations have, the word socialism for some reason has a bad connotation in the US. I think people might not understand its actual definition. It's really about government supports for the population, like providing basic health care or other types of supports. It's not about like handouts or, people not working. But most developed nations have a certain type of socialist background that makes it just a different conversation. And the other thing that most developed nations have is less allowance of corporate interests to be involved in their governments, their policies, and their even, down to speech. Or corporations can engage in speech communication that cannot happen in other countries, marketing and advertising, things that don't happen in other countries because there's just a different framework of it. So I would say even with federalist systems in other countries, it's not that's not what sets the US apart. It's kind of the other things about the US that sets it so far apart.
Mm-hmm.
All right, so we will move on to our last question. So in which areas of public health do you think preemption is most damaging or has the potential to be most damaging? And do you think it has any variation depending on the party that controls the state government?
So, I'm not going to say that there's a partisan. This happens in both types of states. There are a few states that always have a trifecta in the southeast of the United States that have a lot of preemption, but you can't say that this is a partisan issue because it happens in states that have trifectas the other way too. So you can't really, I wouldn't make that argument, but I would say in terms of damage, I guess I'm worried about the country on all these topics, but can you paid sick leave? We have no paid leave in America, and we have, COVID. So these are big problems. LGBTQ civil rights. This should be federal law. The firearm safety. We have a huge firearm violence problem in the US that's increasing over these last few months. Frankly, I think nothing's worse than the other, but I think it's all pretty bad. So I'm sorry that I left you on a Thursday evening with this horrible news, but I feel that I must educate the world on the realities of preemption.
And we really, really appreciate you joining us
Thank
this evening. This was really an incredible discussion and so fruitful. And like I said, these ideas are really going to be extremely useful to participants. I took quite a few notes myself, so I'm really excited about that. So thank you so much to all of the participants that joined this evening. Special thank you in particular to the NYU Politics Society and the NYU School of Global Public Health for helping us with this event. And obviously, like I said, to Professor Pomeranz for so graciously sharing your expertise with us this evening. Again, we encourage you all to please head to our link tree, which is linktr.ee/NYUPPS, or email us at publicpolicysymposiumnyu@gmail.com to learn how you can get involved with this year's Public Policy Symposium, join our email list, and receive updates on the latest news. So thank you so much for joining us.
Thank you.
Thank you so much, Professor.
Thank you.